How many times have you gone to a doctor, a therapist, or another practitioner only to realize that they're probably not really listening to you and you're likely to not get the results that you're wanting? I know I've been there many times, and it can be extremely frustrating when you're trying to find answers for your health, but it doesn't really seem like that you have the support team that you need in order to get there. So, for those of you who don't know me, I'm Dr. Summer Hopkins. I'm a chiropractor. I'm also certified in the Schaefer Protocol, and I help families conceive radiantly healthy children. So that's what I want to talk to you about is just a little bit about finding the right practitioner, why it's important, and how to do that. But before we get into it, please be sure to like, comment any questions that you have, and definitely subscribe so you don't miss any future content. Now, like I said, that has happened to me so many times where I have scheduled an appointment with a doctor, a therapist, another practitioner. Usually, you have to schedule those appointments pretty far in advance. So you look forward to this, you're finally getting the answers that you want. You get there, and almost immediately you can tell that you're not going to get the answers that you want. They're not going to listen, they're not going to support you, and you're kind of just a number. They want you in and out as fast as possible. So I know when I'm looking for a new doctor, a new practitioner, some of the things that I look for is what are their values? Are they more holistically minded, which I am? Are they going to try to throw a pill for every ill? So every symptom that I have, are they just going to try to cover it up? Or are they actually going to figure out why that symptom is there in the first place? But the main thing that I'm really looking to see is, do we connect well? What's their personality like? Now, I understand we're not there to be best friends. However, I do want to make sure that they understand how important it is to listen to me and that they're going to actively listen and really pay attention to my concerns and try to figure out what I'm there for and get the results that I want. It can be very frustrating when you are already frustrated with health issues to feel like you're being shut down, that you're being ignored. And personally, I cannot tell you how many patients have come into our office saying the exact same things, that they know that they aren't feeling great, they're not feeling at their best, they know something is wrong, and their doctor just doesn't really listen, just says, oh, it's all in your head, or here, take this pill, it'll be fine. But they know deep down in their hearts that something deeper is going on. So it is super important to try to find a practitioner who is not only there to guide you and support you and give you the direction that you need and hopefully find the answers that you want, but at the very basis, the very foundation, they should be able to connect and show you that they care and that they're listening to you. Now, when you're going through health struggles, especially when it comes to your fertility, it is extremely important that the people that you have on your side help you to feel supported and heard. Is that what you have currently? The other super important thing to look for when you're trying to find a practitioner to help you through this is to understand what paradigm or what mindset they're coming from. Now, in healthcare, there are two main forms of health. So there is pathogenesis, and then there is salutogenesis. So, pathogenesis is all about the study of symptoms, disease, and treatment. So, essentially, they're going to take all of your side effects, all of your symptoms, and your blood labs, all of those things, put them and figure out a diagnosis, and then try to find a treatment for that. With salutogenesis, however, instead of trying to figure out what's wrong with your body, what we're looking to see is how can we help to support optimal health? What is it that you really want, and what is it that your body truly needs in order to be healthy? So it is the study of what makes people well. The salutogenic model is really where I come from and where many of my other colleagues come from who do this work. Because while you can go to a fertility clinic or to a doctor, whoever, and pretty much get the same blood tests and the same symptoms with the same diagnosis over and over again, they're pretty much just going to throw a treatment at you, which isn't really going to fix the problem. It is a cover up for those symptoms. If you think about a dog, and if I were to step on the dog's tail, it's probably going to start barking, whining, it may even bite me. Now, if we were to apply this into the medical world, essentially what a medication or a diagnosis or these treatments are is putting a muzzle over this dog and saying, all right, it's barking, it's whining, we just need to calm down the bark and the whine. We need to silence that. So they'll give you a medication, they'll give you a treatment. That is how it goes. With the salutogenic model, we say, okay, obviously there is a bark for a reason, there's a whine for a reason. What is that? Oh, it's probably because we have our foot on the dog's tail, right? So why don't we just take our foot off of the tail? So obviously it's a super basic, simplistic explanation. That's essentially the difference between these two forms of healthcare. And really that is why I'm so passionate and why we look at the salutogenic model, because we know we're trying to build health. We want you to have the best life possible. And really that is what is important. So make sure when you're going through a journey like this, something that isn't as important as this, that you understand where the paradigm, or again, where the mindset of your practitioners are. Because if they're just looking to cover up your symptoms, it may not be the best relationship for you. It doesn't necessarily mean that they're wrong. It just means that they may be wrong for you. And it's time to look for different questions to find different answers. Now, after years of me personally having pretty much the same experiences that you probably have with doctors, I've learned just how important it is to get to know them on a little bit of a personal level before actually committing to working with them. So that is why I have the 15-minute complimentary consultation. So again, it is a free consultation. We talk over Zoom, and this is about getting to know you and your history, but ultimately seeing if we connect together. If you feel like you're going to feel valued and heard and supported throughout your journey if you work with me, and I see if you're a good fit for the program. So ultimately, we'll go through your history, see if we're a good fit, and then go from there. If you do decide that we connect well together, then we will set up a time where we can do an exam, do a bunch of different functional neurological testing, so I can figure out your baseline health. From there, we work together to figure out a personalized plan with direction and goals so that you know exactly what your job is, I know what my job is, and we know what our end goal is together. If for any reason you don't think that we're going to work well together, I do have several colleagues that I absolutely adore that I would be able to send you to as well, so that you know you always have options, and that's what we're here for. So if you have any questions, feel free to reach out. And again, if you want to schedule that consultation, the link is below. So I hope you guys found value in this, and I hope you all have a wonderful day.